CPK, or creatine phosphokinase, is an enzyme present in skeletal muscles, the heart, and the brain, and its presence in the blood is directly influenced by several factors, including intense physical effort. When a workout is performed with great intensity, microinjuries in muscle fibers are common, and CPK is released into the bloodstream as a result of this process. Monitoring this enzyme can be a powerful tool for understanding the intensity and effects of training on the human body. The increase in CPK levels is, therefore, an indication that the body has been subjected to significant effort. This increase is often accompanied by delayed onset muscle soreness, also known as DOMS, which results from microinjuries and inflammation in muscle tissue. Despite this, the rise in CPK itself is not harmful, being merely a marker that indicates the necessary recovery for the muscle to strengthen and adapt to the stimulus. During intense workouts, mechanical stress on muscle fibers leads to the release of CPK. The greater the effort, the higher the concentration of this enzyme in the blood tends to be. High-performance athletes and individuals who perform strength training often exhibit higher CPK values, without this being a problem, as long as they pay attention to proper recovery. Monitoring CPK levels can be useful to determine if a workout was truly intense. When values are well above average, this may indicate that the body has been subjected to an extreme stimulus, requiring more time for rest and recovery. In these cases, the use of nutritional strategies such as supplementation with amino acids, proteins, and other essential nutrients is fundamental to optimize recovery. Supplements play an essential role in muscle recovery and the reduction of CPK levels after intense workouts. Whey protein, for example, provides the amino acids necessary for protein synthesis, assisting in the repair of muscle fibers damaged during training. Branched-chain amino acids, BCAAs, help reduce muscle catabolism and delayed soreness, facilitating faster recovery. Another valuable supplement for intense workouts is creatine. Creatine helps supply energy to muscle cells, especially during high-intensity, short-duration activities. In addition to improving performance, creatine contributes to muscle recovery, helping to minimize the impact of microinjuries and, consequently, reducing the release of CPK. It is important to emphasize that very intense workouts, without adequate rest, can excessively elevate CPK levels. This can happen, for example, when someone performs several consecutive days of high-intensity training without allowing the muscles to recover. In these cases, supplementation can be an important tool to accelerate recovery and maintain the balance between stimulus and recovery. The increase in CPK can also be related to factors such as dehydration, which intensifies metabolic stress on the body during exercise. Therefore, in addition to maintaining proper nutrition, it is essential to ensure constant hydration before, during, and after training. Supplementation with electrolytes can also be an excellent strategy to prevent dehydration and maintain performance. Studies show that antioxidant supplements, such as vitamin C, vitamin E, and fish oil, rich in omega-3, play a fundamental role in reducing oxidative stress and muscle inflammation. These supplements act directly on the repair of muscle fibers and the reduction of symptoms associated with intense training, such as pain and excessive fatigue. Another important factor is sleep. Quality sleep is essential for muscle recovery and the regulation of CPK levels. During deep sleep, the body releases anabolic hormones, such as growth hormone GH, which accelerate muscle repair and reduce the impact of microinjuries. Supplementation with nutrients that promote sleep, such as magnesium and melatonin, can contribute to optimizing this process. The practice of active recovery strategies is also effective in reducing CPK levels. Activities such as stretching, light walking, and myofascial release techniques help increase blood circulation and eliminate metabolites accumulated in the muscles during training. Another widely used supplement is beta-alanine, which helps reduce muscle fatigue during high-intensity workouts. Beta-alanine increases carnosine levels in the muscles, neutralizing lactic acid and improving endurance. This can reduce the impact of intense training on muscle fibers and, consequently, minimize the increase in CPK. It is important to note that CPK values can vary among individuals, depending on factors such as age, gender, physical conditioning, and the type of training performed. Well-conditioned athletes tend to show smaller elevations in CPK compared to beginners due to greater muscle adaptation to intense stimuli. For those who train frequently, supplementation with glutamine can be beneficial. Glutamine is an amino acid essential for the immune system and muscle recovery, helping to reduce the impact of intense training and CPK levels. Additionally, glutamine assists in replenishing muscle glycogen, which is fundamental for energy recovery after physical exertion. Leucine, one of the main amino acids found in BCAAs, also plays a key role in muscle recovery. Leucine is a potent activator of the mTOR pathway, responsible for protein synthesis and muscle growth. By consuming supplements rich in leucine, the muscle recovery process is accelerated, helping to reduce CPK levels after intense workouts. Therefore, monitoring CPK levels combined with the strategic use of supplements and good recovery practices is a valuable tool to maximize training results. Proper recovery not only reduces the risk of injuries, but also allows the body to strengthen and evolve continuously.